So let's start mammary glands. So basically, in the female, after conceiving baby, okay, after conceiving baby, the female will give feeding to the baby. Okay, so that's the reason the mammary glands help to feed the baby. Okay, and second thing is that the mammary glands will feed the baby if the conceiving now doesn't happen. So what will happen? Mammary gland doesn't activate. Okay, if there is no pregnancy, no conceiving is there, mammary gland doesn't active. The mammary glands will still there, but functional is not happening. Okay, so next we'll talk about mammary glands. The mammary glands are structurally related to the skin, but functionally related to the reproductive system because they produce milk for the nourishment of offspring. Enclosed within the breast, the mammary glands are anterior to the pectoralis major muscles. Their structure is shown here. You can see that. So basically here what anatomically it is related to the skin. Okay, the structures like skin is covering, but functionally there is a gland inside the skin that is mammary gland. Okay, so this is the structure. Okay, it is near the chest region, pectoralis major, pectoralis muscle, near the pectoralis muscle, and inside or interiorly, anteriorly, we have ribs, we have lungs, all those are attached. Okay, so basically, so what is the function? To produce the milk for the nourishment of baby. Okay, the glandular tissue is surrounded by adipose tissue. The alveolar glands produce milk after pregnancy. The milk enters lactiferous duct that coverage at the nipple. The skin around the nipple is pigmented area called areola. Basically, this is the adipose tissue. Okay, in the adipose tissue, we have uh, alveolar glands, alveolar glands. In the adipose tissue, we have alveolar glands. So these glands produce milk. Okay, with the help of lactiferous duct. This is the ducts. This is the ducts means uh, the the path of the traveling of the milk. So it will enter all this will connected to it is here, and we have one nipple is there, and we have the black color pigmented color that is called areola. Okay, the formation of milk is under hormonal control during pregnancy. So it is also control of hormone endocrine glands. High levels of estrogen and progesterone prepare the glands for milk production. Okay, prolactin from the anterior pituitary gland cause the actual synthesis of milk after pregnancy. The sucking of the infant on the nipple stimulates the hypothalamus to send nerve impulses to the posterior pituitary gland, which secretes oxytocin to cause the release of milk. The effect of these hormones on the mammary glands are summarized. So basically, which hormone help? Prolactin and oxytocin, progesterone, estrogen. All these hormones together work to produce milk. But one will stimulate, one will produce the milk, one will stop the milk production. So all we'll discuss in this table. So here we have the all the reproductive hormones of female. We'll discuss here. Okay. So first thing is that we need all these hormones. So let's discuss the female hormones because during menstrual cycle, those hormones are related to the female, which will help for better understanding. So here we have the FSH. FSH follicle stimulating hormone whose will secrete anterior pituitary gland. So most of the hormones is secreted by anterior pituitary gland only. FSH hormones, what it will do, it will initiate development in the follicles, ovarian follicles. Okay. So most of the hormones are secreted by anterior pituitary gland. So we have FSH. FSH will stimulate ovarian gland, ovarian follicles, and another is it stimulates estrogens by follicle cells. So here, pituitary gland release FSH. FSH have two works, that is ovarian work and estrogen work. You have to remember that. LH hormone. LH also released by anterior pituitary gland. It is ovulation. Main process of oogenesis will happen here. Okay, converts the rupture ovarian follicles into the corpus luteum. So whatever the egg will come out of the corpus luteum will what will do, it will convert the whatever follicles are there, ovarian follicles are there, into corpus luteum. Corpus luteum, what will do, it will secrete progesterone. Here estrogen is a progesterone, right? Estrogen, what estrogen will do, promotes maturation of ovarian follicles. Again, it will promote and will give blood supply, okay, and will cause secondary characteristic and growth of uterus, reproductive organs, memory depths, and it will, what it estrogen do, estrogen will prepare for pregnancy. Whatever necessary things are there, it will prepare for fat deposition from hips and thighs. All will happen, broadening of pelvic bone. Okay, it will create the environment. Estrogen, progesterone promotes further growth of blood vessels in the endometrium and stores of nutrition, inhibit contraction of the myometrium. So what will it do? It will stop whatever other effects of the uterus, like contraction, and it will improve the blood circulation, nutrition. So progesterone have the more higher function than the estrogens. Okay, here estrogen and progesterone. Next, we have other hormones also there, inhibin and relaxin. Inhibin secretion of SHS, inhibits secretion of SHS. It will stop FSH hormone. And relaxin will, what will do? It will facilitate implantation. It will contract. Contraction, what will happen? It will relax. So they are mostly helpful. Relaxing, it is inhibit the FSH hormone. After pregnancy, you doesn't need FSH hormones. Also relaxing during pregnancy. We need what we need. We need to promote the ligaments. We need to stop the contraction of the uterus. All this will helpful. So these are the hormones which is very necessary for reproductive system. We need FSH, LH, estrogen, progesterone, and other hormones. Okay. I think you understood this table. You have to remember all those things. Next, we have very important, that is menstrual cycle. So how it begins, what are the hormones will helping? Because during menstrual cycle only we have 2 days. The ova is in mature state. So whenever sperm enters, it will fertilize. Okay, chances of fertilization are higher during this time. Okay, so we know the menstrual cycle. So when that ova will become mature, so then easily the fertilization will happen. Okay, so the menstrual cycle. The menstrual cycle includes the activity of the hormones of the ovaries. The menstrual cycle means activity of hormone, at which time is FSH improved, at which time LH needs, at which time we need estrogen, progesterone, all this. Ovaries and anterior pituitary gland and resultant changes in the ovaries. These are the all incorporated into, which may look complicated at first, but refer to it as you read the following. So basically, so we need two organs for this cycle. One is anterior pituitary gland, and second one is ovaries. So both are very important for the female, anterior pituitary gland and ovaries. So first, let's start. First, the four hormones involve FSH and LH from the anterior pituitary gland, estrogen from the ovarian follicle, and progesterone from the corpus luteum. So we have the four hormones: FH, LH, estrogen, progesterone. FSH from LH, anterior pituitary gland, both are from estrogen from ovarian follicle, progesterone from corpus luteum. Okay, understood? The fluctuation of these hormones are shown as they would occur in an average 28-day cycle. The cycle may be described in terms of three phases. So we have three phases: menstrual phase, follicular phase, luteal phase. So in this diagram, we able to know that here this is the hormonal levels. Which hormone is high? So this is the FSH hormone. It is high, low, then gradually high and low. Luteinizing hormone gradually high, gradually the graph increases, gradually the LH decreases. And we have FSH estrogen, and we have progesterone. Progesterone, it is also at the beginning it is low, at the ending it is high. Next, we have ovarian cycle: primary follicle, secondary follicles, okay, graphene follicle, corpus luteum. Here is the very high corpus luteum. It is the where at the 15 days to minimum 15 days to 20 or 22 days. This is the main period for fertilization. It's 4 to 7 days. Okay, best time. Okay, next, what will happen? Corpus luteum will obtain, then progesterone increases. So let's talk about all those things. So we have three phases: menstrual phases, follicular phases, and luteal phases. First we will talk about menstrual phases. The loss of the functional layer of the endometrium is called menstruation or menses. Although this is actually the end of the menstrual cycle, the onset of menstruation easily pinpointed and is therefore a useful starting point. Menstruation may last 2 to 8 days within an average of 3 to 6 days. At this time, secretion of insulin increases and several ovarian follicles begin to develop. So here, menstrual phase is ending phase. Actually, what will happen? The ovulation doesn't happen fertilization. So what will happen? The mature ova will die. And what will happen? The functional layer of uterus. What will happen? The functional layer of uterus will contract, and releasing of functional layer ova from the uterus will happen. And this cycle maybe last 2 to 8 days. This is average 3 to 6 days also happen. Okay. So what will happen in this period? FSH is increasing, gradually increasing, and ovarian follicles also begin, because to develop the new cycle, we need FSH and ovarian follicles. Next is follicular phase. So it is the beginning. So after that, the menstrual cycle ended. 2 to 6 days, 8 days had ended. In this period, FSH also improved, ovarian follicle also improved, but functional layer uh, will out from the uterus. Next, we have follicular phase. FSH stimulates growth of ovarian follicles and secretion of estrogen by the follicle cells. So here, follicular cell, the beginning is follicular phase. What will happen? FSH is released, and ovarian follicles will also release estrogen. Follicular cell growth for ovarian follicle growth. So follicular cells will release estrogen. Okay. Next is LH. Gradually, LH also increase. So here, what will it will do? It will slowly, but more slowly. Not LH is gradually improve. Okay. FSH first, and uh, follicular cells will release estrogen, and gradually LH increases. Okay, because it is the beginning of the menstrual cycle. So follicles are very small in size. We doesn't need ovulation. We need some time for ovulation. So the uh, gradually the LH will increase. Okay, understood. FSH and estrogen promote the growth and maturation of ovum. So at the beginning, which will help? FSH and estrogen. LH will begin at the time of matured over. And estrogen stimulate the growth of blood vessels. Here, estrogen will do their work, improvement of blood vessels. Okay, and it will regenerate the functional layer. Okay, this phase ends with ovulation. When a sharp increase in LH cause rupture of mature ovarian follicle. Now the ovum is matured. Now, you have to blast. Or how to rupture the layer of the ovum. So what will happen? Luteinase phase will start. Here LH will increase suddenly. The rupture of ovum will happen. Here the rupture follicles and we have corpus luteum. So corpus luteum will begin the process of releasing of progesterone, okay, as well as estrogen. So what will happen? Progesterone will stimulate the further growth of blood vessels. Okay. And it will also grow the functional layer in the endometrium uterus and also promote the nutritions, glucose, everything, whatever needed. Now the growth will happen. Okay. According to the condition. Now the progesterone secretion increases, LH secretion decreases, LH and ruptured happen, now it will decrease. Progesterone increases, estrogen increases, this will happen. But if fertilization happen, progesterone, estrogen will be there. Okay, but if fertilization doesn't happen, all the hormones will begin to decrease gradually. Okay. Without progesterone, the endometrium cannot be maintained and begin to slut off the menstruation. FSH secretion begins to increase, estrogen, progesterone decreases, and the cycle begins again. Now, again, what will happen? Again, the fertilization doesn't happen. So, what will happen? Contraction of uterus will happen. So, what it will do? It will do the functional layer, which will which will release from the uterus. So how it happened? It will stop inhibin hormone and relaxin hormone, which will help. Okay, it will stop the secretion of SH. Now the fertilization doesn't happen. Now and also if the fertilization happens here, relaxin will work. Relaxin what will do? It will inhibit the contraction of myometrium. Okay, but here fertilization doesn't happen, so a relaxin will doesn't active, so myometrium activate will happen and it will release all the waste products which are begin the dead tissue will be get rid from that area. So the 28 cycles shown in average women may cycles from the 23 to 35 days. So the average cycle is 23 to 35 days. We will know the history. Ask the lady who have the cycle. She will tell. Okay. Women who engage in strenuous exercise over prolonged periods of time may experience amenorrhea, that is, section of menses. This same is to be related to the reduction of body fat. Apparently, the productive cycle ceases if a woman doesn't have sufficient reserves of energy for health and developing figures. So here, what we need? We need energy. If doesn't have energy, the menses will be delayed due to the due because the body doesn't have blood flow. So during menstruation, we need blood flow. Menstrual cycle need blood flow, large amount of blood flow. So adequate amount of blood flow is not there, so it doesn't happen. Amenorrhea will happen. Okay, the exact mechanism by which it happens is not completely understood at present. Amenorrhea may also accompany a state of physical or emotional stress. So it may be due to the emotional stress, physical stress, not eating food, or various other disorders also. Okay, so I think you understood about that. This is the hormones which works and what are the uh, hormones will help for menstrual cycle here. FSH hormone, this is the progesterone, estrogen, FSH hormones, LH hormone. So LH hormone needed for rupture of the ovulation and estrogen and FSH, sorry, LH hormone needed for rupture of the ovum. Okay, and we have estrogen and FSH for complete maturation and progesterone is further development. of the ovum. For the need the environment it will create. So if the fertilization doesn't happen, what will happen? So we have two other hormones also, they inhibin and relaxin. So relaxin doesn't activate. So what will happen? Endometrium contraction will happen. So all the blood vessels which are increased, they will rupture and blood loss will happen for 3 to 8 days or 6 days. So okay, this is the condition where we have this during menstrual cycles. So I think you understood. So you have all the outline here. Please study this and note down that you will get basic details. Okay. So anyone have any doubts, please ask. And we have one more chapter that is human development and genetics. So then after how the human development will happen, we will discuss. Okay. In this second chapter, we will discuss human development and genetics.